So we are going to look at the topical treatments that we usually use in dermatology. Then you understand the wording that we usually use. I'm Dr. Abraham from A&E Dermatology Specialist. So when you're giving topical medicine in dermatology, all these drugs that you apply directly on the skin, the intention can be to treat as a primary skin condition or even other systemic condition. So when you're giving these drugs, we have to be aware of how these drugs work and what they have to go through to achieve the desired purpose. So on the skin, we have a dead layer we call the stratum corneum, and it is very key in this drug administration because it provides for us the rate limiting factor for drug absorption. Remember, it is dead skin. So for the drug to work, it must be in position to pass through the stratum corneum and then reach the targeted sites. And majorly, the stratum corneum is made up of majorly the ceramides, which contribute 50%, fatty acids contribute 15%, and then cholesterol 35%. So because of this, you have to make sure that when you're giving your topical drug, its effectiveness is determined by the skin barrier, which is measured the stratum corneum, and the drug itself, its potency, how it stimulates or how it acts on the targeted receptors, and then its ability to penetrate the skin. So if the drug you apply topically, but it can't penetrate the skin to reach your desired site, then the drug cannot work. So we have other factors that contribute to the effectiveness of the drug, including the concentration of the drug. That's why in some preparations, you see drugs having different percentages. For example, you can have 0.05%, 0.25%, or 1% in cases of topical steroids, and that concentration determines the effectiveness of the drug. So also the integrity of stratum corneum. So when you find that the stratum corneum is still intact, it can actually prevent your drug from reaching the targeted site. And the frequency of application, that's why you see us giving drugs maybe twice a day, apply twice a day, once a day, or three times in a day. And then the occlusive effect of the preparation. So this one usually is determined by either the base of the drug is an ointment, oil-based, or it is water-based. So there are factors that you usually consider when you're selecting the right vehicle containing your drug that you want to give. One of the factors is the skin condition. So is the skin dry, or is it oily, or is it wet, or is it oozing? That will also determine which vehicle are you going to use. The drug property, how is the solubility of this drug and stability? Because some drugs can be inactivated by some components in the skin. I'll give an example. If you have an abscess in an area and then you are trying to numb the area using maybe a topical lidocaine, you know that the pus and the acidity within that environment will inactivate actually the local anesthetic. So you need to be aware of those minute details when you're applying these medicines. And then the patient preferences. Oftentimes you give a drug, maybe it is greasy, and then the patient is like, no, this is too greasy for me to apply. They'll end up not complying. They'll go with the drug, but when they reach home, they'll not apply the drug. So you need to also factor in the patient choice and preference, and also the overall of this is the impact that we have on the therapeutic outcome. Remember, if someone has a skin condition, you want to treat them and get better. So you have to consider all these factors so that you maximize the therapeutic outcome of the drug. So when you are talking about vehicles, these are the bases, or where you have your drug mixed. In dermatology, these words are usually very key. You've heard us use the word ointments. So in dermatology, we describe this as oil-based, greasy, semi-solid substances that can be very hydrating or even lubricating. And we usually use them for dry skin. We've seen patients with atopic dermatitis, any skin condition like psoriasis, lichen planus, parapsoriasis, and the rest. we usually want to use this lubricating and hydrating preparations. An example is petroleum jelly, and the one we commonly have at the clinic, we call it a emulsifying ointment that comes from Kenya. So these ointments, according to classification by pharmaceuticals, for them they further classify them depending on different factors. They have 5 subgroups. The first one being hydrocarbon bases, like the pectrolactam. We can have them being absorption bases, like if the base is the lanolin and its derivatives, or we can have them being water soluble bases like the liquid PEG 400 and then the solid type, the PEG 4000. So these are just chemicals that are also called ointments. Then they classify them also as emulsion of oil in water. So if you have oil in water, that is when you have more than 30% water, but the rest being oil. Usually this one is very good if you're making the dermatology drugs, especially the antifungals. They are very comfortable if mixed in emulsions of oil in water. Then they can also be classified as emulsion of water in oil. Now in this case, the water is less than 25%, and those are the ones that we call creams. So the creams, these are still emulsion where you have water in oil, and we've said that in this case the percentage of water is less than 25%, the rest being oil, and they're very ideal in case you have moist or weeping lesions. For example, someone have nummular eczema that is weeping, you are better suited applying their cream because it has some little drying effects. For example, the hydrocortisone cream. But the challenge we get with these creams is that some people tend to react to the preservatives, so you end up with either irritation or even an allergic contact dermatitis. Then we have what we call lotions. So in this case, this is just a liquid emulsion. So a lotion largely is just ideal for hairy parts of your body like the scalp, or in case you have an acute inflammation, an oil will be better because it is better, lotion will be better absorbed into the skin. And some lotions actually, they're made not to be absorbed in skin, just to remain on top, like the calamine lotion. So in that case, when you apply the lotion, it dries rapidly, then it leaves the zinc coating on the skin, such that you end up with the desired effect of drying and pruritic effect of the calamine lotion. The other example that I can give here, we have the Candid B lotion. In this case, you have an antifungal, which is cotrimazole, and then the beclomethasone as the steroid in a preparation of a lotion. So this one, we usually use it in the scalp inflammation because you know that a lotion will be easily applied and it will actually be easily absorbed on the hairy parts of your body, as opposed if you applied there a cream. Then the next one that we have is a gel, which is just a transparent semi-solid emulsion in an alcohol base. So the base is now the vehicle. So in this case, your base is alcohol, and all gels are very drying actually. So when you apply it on your skin, the alcohol will evaporate and then you have a drying effect. So this is usually ideal for oily skin. You've seen us using gels when you're treating acne, because in acne, someone has a dry skin. So when you give them Adacin gel or the clindamycin gel or metro gel, we've seen us using gels, because at the end of it all, it has this drying effect, and since it is transparent, it doesn't leave any white coating, and it has this fast drying effect. Then we go to the foams. For foams, this is just a quick drying air reformulation. In this case, it's usually ideal for the scalp or any areas of the body, and also in sensitive skin. So in this case, an example I could give is the minoxidil foam that we use in treatment of hair loss, what we call alopecias, and it comes in a formulation we call foam. Then we have what we call pastes. Usually pastes, you have a powder, then you dissolve it in an ointment. In this case, you have 50% a powder mixed in an ointment. So in that case, you get what we call a paste. and it is less greasy and more drying and less occlusive compared to the ointment, because now the ointment is the original base, so it is very occlusive, very greasy. But now when you add in a little powder, the greasiness comes down, then it becomes more drying and less occlusive. And this is what we usually give in case someone has maybe an oozing wound or chronic inflammation. So we've seen us giving zinc oxide paste in children with dermatitis because we know it has that little drying effect and it is easy to apply. At the same time, it has some effect to cause emoliation or to moisturize the skin nicely, because some component of it is greasy, that is the ointment that is already existing. Then we have what we call patches, and these are medicated devices or adhesives that apply to the skin in case you want to deliver the drug. We've seen it being used in nicotine patches, even the salicylic plasters, they can be in form of patches. Then we have what we call the sprays. These are just aerosolized drugs that they put there maybe a gas under pressure, and when you shake, so the gas particles in form of powder are suspended in this pressurized gas. So when you spray the drug comes out to reach the targeted area. And you've seen it being used in hard-to-reach areas, especially sensitive areas. Maybe we've seen these sprays like the nebulizers where you want to reach the lungs. So you spray so that powder is deposited directly to the targeted site. We also have antifungal sprays that also can be used in the intertriginous areas and genitalia. Then we have liquid preparation. So in liquid preparations, we have what we call solutions, and solution chemically is a mixture of two or more substances that usually mix uniformly to form a clear liquid. Then you have what we call tinctures. So for tinctures, usually these ones are hydroalcoholic solutions. In this case, you have alcohol for 50%, and then the rest maybe being water or any other chemical. So that one makes it to be a tincture. So it will be very drying when you apply it on an area. Alcohol will evaporate. Then you have that drying and cooling effect. Then we have what we call shake lotions. So shake lotions, we just get a powder, then you add it to a solution. So in this case, when you add that powder, you are increasing the surface area to allow for more evaporization of the base. Maybe you used alcohol or water. So the powder that you adds bulk plus increasing surface area to allow for evaporation of the base that is usually either alcohol or even water. Then we have what we call suspensions. In this case, you have a two-phase system, which usually has an insoluble drug that is suspended in a liquid with a concentration of about 20%. So you have 20% of the insoluble drug, then you put it in a liquid and you're sure it will not dissolve. So that is a suspension. And when you leave them to settle, you see that the drug will settle down and the liquid will be up because they can't mix. So in dermatology, we have a few vehicles or ingredients that we use when you're making these vehicles. These can be grouped depending on their properties. We have those that are emulsifying agents. I have those that are emulsifying agents like cholesterol, like wax, like all these polyoxyl phosphate are just cholesterol derivatives, and then sodium lanolin and lanolin sulfate. This also has emulsifying effects. Then we have others that also have emulsifying effects, like the carbomas, though not commonly, lanolin and the derivatives. All these are emulsifying. Then you have what we call stabilizers. When you add the stabilizers, they help you maintain the integrity and the effectiveness of the drug that you are mixing. And these ones usually include like citric acid. This is a common one, the benzyl alcohol, and the rest, the propyl gallate and sodium bisulfite, all these drugs are stabilizers. Then we have solvents. Solvents is things that dissolve a solid. You remember that chemistry. So like alcohol can dissolve your drug, then glycerin, these are taken to be salt, including water. You know, water is the universal solvent, right? So it can almost dissolve almost everything. And we have thickening agents that usually add bulk, like the beeswax, like the pectolactam comes again here, and then the xanthan gum. This one comes from trees. So these are just thickening agents. They add bulk to whatever you are doing. Then you have what we call emollients. Now emollients usually moisturize also the skin. So like glycerin, the oils, the isopropyl, myristate, all these ones are emollients and different, and even squalene is also an emollient. Then we have what we call humectants. Now humectants, usually they absorb water from the surrounding and then keep it on the skin. So that is like glycerin and then also sorbitol solution and the propylene glycol. These are common humectants that you usually use in dermatological preparations. So what you have to pick here, that you will have a solvent, thickening agent, emollient, humectant, then you have emulsifying agents and also stabilizers or preservatives. So this triangle here tries to show you the different formulations that we've been talking about as existing in different states of matter. So we have the solids, then we have the liquids, then you have these greasy preparations like the oils. So in this case, you have oil at one corner, then you have a powder at the other, then you have water at the other side. This can also be alcohol as a solvent. So depending on the percentage of each of these ingredients, you end up with a different formulation. For example, you can have a powder which is just powder alone. We've seen this powder being used like in children, like the baby powders, and usually they have that drying effect. They lubricate, and they come with side effects, including formation of a cake, what we call caking, formation of foreign body granulomas, and even irritation on the skin. Then when you get this powder and you mix it in an ointment, then you get a paste. So that's why the paste here is between the ointment and the powder, because when you mix the two, provided the paste is 50% and more, or more, you get, if the powder is 50% or more, you get a paste. Then ointment is slightly from the oil, this crude oil that is manufactured. Then if you have now your ointment, you said ointment has different types. When you have now your water mixed in oil, forming an emulsion, then you get a cream. And then you can have oil mixed in water. Then you get still an emulsion. Though in dermatology, all this can be referred to as creams. Then you can get foam, you can get a lotion, which majorly the base is water. So if someone has dry, oily skin, you don't want to give something greasy, something oily, then you come to this angle where you give a lotion, which is majorly has water. Then the gel we said you have alcohol, where you mixed any medication where your base is alcohol. So that's why it has a drying effect and it is usually transparent. So when you get more of the alcohol, then it becomes a tincture. If it is 50% alcohol, then it becomes a tincture. So when you now change and then you pressurize any powder, or if you pressurize any medication, then it becomes a spray. Then it can be a shake lotion. If you have your lotion here, isn't it? Then you mix it with a powder that will just increase the surface area. It becomes a shake lotion. So all these formulations are interconnected, and understanding their definitions and each of them and when they are used, it is very key in dermatology. So how to choose the right vehicle? So when you're choosing the right vehicle, one, you have to look at the condition. Is it acute versus chronic? location of the body. Is it the face? Is it the scalp? Is it the intertrogenous area? And patient's preference, taking into account some patients are sensitive to some preparations, especially maybe the preservatives like the parabens. So you have to consider patient's preference, because some patients will tell you this application is too greasy, I can't put it on my body. So you have to find an alternative so that you improve the outcome, therapeutic outcome. Then the drug compatibility. This is, you look at the solubility, stability, and then the absorption rate of the drug. So thank you for this, for your attention, and this comes the end of this session. But remember, this preparation, you have a vehicle is the base. And then the drug becomes what you're suspending in that base. The base can be pectolactam, the base can be oil, the base can be water, the base can be alcohol. So depending on the base and the proportion, you can end up with an ointment, a cream, a gel, a tincture, or any of those preparations we've talked about. Thank you very much. God bless you. I'm Dr. Abraham from A&E Dermatology Specialist.